Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a February 2nd, 2022 update from the Dubuque County Public Health Incident Management Team. Pretty much everywhere in the U.S. continues at high community transmission for COVID-19. In Dubuque County over the last 7 days, 1,034 cases are reported. That's an increase from last week's temporary dive to 683 cases, but an even higher number than our previous high of 1,003 back on January 19th. The labs continue to be very busy analyzing tests. This is evident because some of the cases reported in the last 7 days were tested well over a week ago. Nonetheless, we still increased in the number of positive COVID-19 cases reported from the last 7 days, along with an increasing number of active cases in the community. Omicron continues dominating the variant with an estimated 94% of the Dubuque County positive cases. The best thing to do if you're having symptoms of COVID-19 is to get tested, either through one of the providers listed on the city or county website, including Test Iowa and a similar test now available through Hardig Drug, or by the over-the-counter test kits you can buy. But here's the thing. I've talked about how confusing all these various tests can be. But let's focus on the rapid self-tests you can purchase or get from the Federal Home Delivery Program at covidtest.gov. Self-tests may be used if you have COVID-19 symptoms or have been in close contact or potentially exposed to an individual with COVID-19. Even if you don't have symptoms and have not been in close contact with an individual with COVID-19, using a self-test before gathering indoors with others can give you information about the risk of spreading COVID-19. This is especially important before gathering with individuals at risk of severe disease, older individuals, or those with immunocompromised conditions, or even those who aren't vaccinated, and children. But specifically, the best timing when using a self-test is this. If you have COVID-19 symptoms, use a self-test immediately. Or, if you are a close contact to someone with COVID-19, self-test after at least 5 days. If that turns up negative, do another test in 1 or 2 days, at least 24 hours apart. This is because a negative self-test result means that the test did not detect the virus, but this doesn't rule out a COVID-19 infection. A single negative self-test result may not be reliable, especially if you have symptoms associated with COVID-19. And finally, if you're testing before a gathering, test immediately before the gathering or as close as possible to the event. If you test positive on an at-home kit, it's a good idea to let your healthcare provider know, depending on if you have underlying health conditions or are elderly, because you may be eligible for one of the new antiviral medications. And please keep in mind, you cannot test yourself out of quarantine or test to shorten your isolation period if you have COVID-19. Self-tests are used to detect current infection. No self-tests are available to detect antibodies to the virus indicating past infection, nor can they differentiate between being infected or infectious, meaning whether you can transmit the virus to others or not. In closing, as winter continues, thanks to today's groundhog report, and as we enter into February, there are a few things to add to the ongoing never-ending pandemic. Black History Month can provide for some interesting reading, TV watching, or events, along with additional ways to focus on your health, like American Heart Health Month, Cancer Prevention Month, Fasting February, National Self-Check Month, and let's not leave out Creative Romance Month. You probably get the idea on board with winter. Whatever the case, continue to be safe, work on your health and well-being, and do something to show the love this month. Thanks for tuning in, everyone.